Well, with all these cuts to social services and stuff like that, I kind of over the last couple of days wanted to talk about it. Like I've dealt with, I talk about mental illness and disability because those are the things I know. There are lots of people talking about like one of the big groups that are going to be hit in these cuts are going to be elderly people living on retirement. I wish I could talk about that. I mean, I feel sad that because of these cuts, there's probably going to be a lot of homeless elderly people. And there are probably going to be elderly people that will no longer be in nursing homes. They'll have to go because the funding, Medicaid and Medicare pays for, nursing homes and doctor's visits for elderly. And that when that gets cut, they don't have the funding for that. But I don't have the knowledge to really talk about it. Not that I don't care. I just don't have the knowledge to talk about it. I look at it this way. The We're not seeing anything new. In order to understand what's going on right now, you kind of have to look at what's happened in the past and for people with mental illness, they've known cuts and they've known organizations going away because they just weren't properly funded, and they know that their services have been basically decimated forever for cheaper and less and less taxes. The mental health system is literally a story of nothing but underfunding and cuts since the very beginning of the mental health system. If you look back at the stories, any story, you just go out and look up a mental hospital. There are tons of hospital stories about how bad they were and how much um, how they treated their patients and all that kind of stuff. And I bet you every single one that you find online has this caveat, whatever, has this on it. Not enough funding, overcrowded, overworked staff, not enough staff, cuts. Everything, a lot of the things that happen bad, horrible things that happen bad to people with mental illness over the years was because of cuts to the funding of the facilities that took care of them. Underfunding was one of them. The Literally, if you look up the history of the orbital, what is it, the lobotomy, where they literally take an ice pick and shove it up into somebody's brain and basically destroy them. A big push for the lobotomy was it was cheaper to turn these people into vegetables than it was to take care of them, just the way they were. You don't need as many staff. They sit in their bed as a zombie. You just come in there and feed them, turn them over so they don't get bed sores. It's way cheaper to have one nurse rather than five or six because you have to make sure they don't have a meltdown. People after the lobotomy really didn't have meltdowns anymore. They were just basically vegetables. But that was all to save money. That was just hey, we can save a bunch of money if we just. You think anybody was like, hmm, shove ice pick into brain? They weren't idiots back then. They knew that that was a dumb idea. And then Thorazine came along. Thorazine was another step. It was a chemical. It was called a chemical lobotomy. It destroys the brain. It turns them into vegetables. And it was, believe me, I was on Thorazine when I was younger. Not as much used these days because it's an old drug and it's a terrible freaking drug to be on. But that it that was a way of saving money. It literally took people and turned them into zombies. Cheaper to maintain at mental hospitals. And when that came out, hey, we don't really need these big facilities anymore. Hey, we can stick them in small facilities in town or just literally throw them out and here's a check every month to go get an apartment. A lot of people that were in facilities were moved over to public assistance, uh, Social Security, stuff like that. And a lot of them still to this day, if you want a good, I'll look it up. There's a really good uh, documentary about this. The program was called Right to Fail. Here it is. This documentary right here, if you really want to see a really good documentary on mental illness and how they're treated in our society today, and the kinds of programs that are out there, and they go over, right? They go over, hey, even this is failing. Underfunding, programs aren't there. They aren't watched because there's nobody really working on it. It's we're just in another stage. Social Security took over for them being in housing, and this is where we are now, on medication, at home, being maintained through local facilities which are underfunding, and now they're cutting that. Social Security is a goner. They are going to cut that down to nothing. They're already firing half the workforce of Social Security. They're already talking about checks not being able to clear, backlogs, and all. They have a backlog of people that need to be on disability and a backlog of all kinds of shit. Problems, because there are always problems with payments and all that kind of stuff. And they are firing the people that take care of that, which is already backlogged over a year. They're cutting half the workforce. This is going to destroy Social Security. These are the people that you think the people out on the street right now are crazy. These people on on schizophrenia drugs and stuff like that are sitting at home or sitting in the family members' houses being maintained. This is going to be another level of hell if they get thrown out on the street. They're cutting it. And this isn't even good financially. These people are mentally ill, including me. I'm not as bad as a lot of these people. I have disabilities, but I'm not as bad as a lot of these people. But these people, they get thrown out on the street. They're going to cause problems. These are people you don't want to live next to, them living in a tent. This is going to be hell on earth. A lot of them are also on Section 8, stuff like that, because Social Security doesn't pay a lot. And you talk about people, and you watch the documentary I showed you. They go into the funding. They go into how they're set up in housing. There are programs for this. Those programs are on the chopping block. They're cutting them. You watch the program and see the type of people that are on disability and on Section 8. So that is the majority of people that are on Section 8 for, for mental illnesses. And they're cutting it. Where do you think these people are going to go? Now, once they get to the street, they're not going to stay on the street. They're making it all over the country. They're making it illegal to be in a tent on the street. So these people are going to go on the street, get arrested for being in a tent, and thrown in jail. They're mentally ill. They go into jail. And that cost right there, all by itself, is more expensive than the cost of just giving them a check. This is why they took the people on disability and they took the people out of the mental hospitals and put them there. That was as cheap as you could make it for these people. That was the cheapest. You couldn't even get any cheaper if you didn't pay them. If they go on the street, they're going to be in jail, which is going to cost society even more. Not only that, it's going to be hellacious for them. And they don't need to be in jail. There are already stories. You can look it up. There are already stories. Because of cuts to the mental health system, that the biggest mental health provider in our country is the prison system. That's just going to add more burden on them, more facilities that they had to add. And I'll say it again, it doesn't save money. Because them systems, those facilities cost money. It costs just as much as them being in a mental hospital. And it is cheaper to just give him a check and put him in Section 8. It is way cheaper. So this whole thing, like they do this over and over, and it never saves the United States any money because they don't think this shit out. It's crazy. It's just absolutely crazy. They did this to us because nobody complained. They've been doing this for years. You haven't heard anybody really jumping up and down going, when is somebody going to do something about the people that have mental illnesses? When are we going to make sure that they have the facilities necessary to take care of them? Nobody's really done that. The cuts that they are doing now, right? The cuts that they are doing now are way more. Like if you cut everything out of disability, all of us are thrown to the streets. It'd be horrible. But that would be pennies to the cuts that they're making. The amount of people that they are firing in the government, it's pennies. That doesn't cover anything. If you look at the amount of tax breaks they are giving the wealthy, compare that to the money they are cutting from people with disabilities and what Section 8 and welfare and all that kind of shit, pennies. Where's the rest going to come from? It is going to come from your services. And now you hear people jumping up and down going, wait a second. You mean they're going to cut our services? They're going to cut money from farmers? They're going to cut money from our parks? They're going to cut money from our schools? I could say right now, where the fuck were you when they were cutting money from all our funding, but you weren't listening. They are going to cut this until there's nothing left. The only cities that are going to be taken care of are the cities like Beverly Hills and stuff like that, where the rich people live and they have big, expensive houses. Those are going to be the places that are taken care of. They're going to have the nicest private schools. They're going to have the nicest nicest streets. They're going to have the nicest parks. And the rest of you are going to get jack shit. They can no longer cut anything from our services, which they've been doing. We were the easy people to cut because nobody cared. Now it's your turn. Good fucking luck. On to the next one. You guys, just before I go, you better get angry. As a person that has seen this their whole freaking life, they are not going to stop. They haven't stopped cutting funding from us for my entire life. Now they're on to you. This amount of anger that you people are putting out right now is not enough to stop them. They will get their money. They're not going to stop until every dollar of funding towards the middle class is gone. All your colleges, all your funding that makes college affordable, that gives you your kids food at school, that makes sure that you have teachers and books, that's gone. And they will do it. They will cut and cut and cut until you have nothing more. You'll be in the same hole as us with nothing. Better get angry. You have nothing. On to the next one.